Hi, my name's Abby. I live in Southwark and I call myself a surviving cancer patient, and this is my journey through NHS. I kept going back and forward to my GP every other week, telling him how tired I was. I got constipated. Eventually he sent me up, back and forward to A&E. Every time I was taken into A&E, I was told, just change your lifestyle. Eventually, within a year, I was literally in and out of hospital every other week having blood transfusions because they didn't know why and where my blood was going and why I was losing blood. A year later, within that year, I had a colonoscopy, but it was not completed, and the doctor said there's nothing to worry about, go home. Just change your lifestyle, go back and start eating red meat, and you should be fine. A year after that, I was diagnosed with stage 3 bowel cancer, and this was my journey. I literally went in and out of the hospital. I had, on one Friday in August, I was told to come in and have a colonoscopy done, and that's how they found out there was a tumour. The following Monday, I got a phone call from the hospital to come up to have a CT scan done on Tuesday. On the Tuesday, I have very deep veins, so it's a bit of a struggle to put any needle through me before this illness. Back and forward, the doctors came round, put the cannula in, went to have the CT scan, it popped out. I eventually had to we called the doctor up and he said he's doing his ward rounds. I said, could I come and meet him on the ward so I can have it done, have the cannula put in again, which he agreed. They called for a porter. I said, no, it's okay, I can find my way around King's College Hospital. I've been in there so long, so I know everywhere now. Went to look for the doctor on the ward, standing waiting for the lift. I thought, let me read this piece of paper which was handed to me, and I read, pathway to colorectal cancer. This is my first time of actually seeing the word pathway of colorectal cancer. No one sat and told me I had cancer. I was shocked. I checked the name, the hospital number, my date of birth, and I realised, yes, they are checking me for cancer. At that moment, I actually wanted to kill myself, run into a bus in front of King's College Hospital, let people know I did die, but I didn't die of cancer. I pulled myself together, went onto the ward, met the doctor again. His next question was, why are my veins deep? I said, I don't know. And he said, oh, is it the chemo? And I said, well, I'm not on chemo. And he goes, oh. Went home, got home, researched about pathway, what does pathway to colorectal cancer mean? And I found out it means they're investigating if I do have cancer. The following Thursday, I met with my consultant and it was confirmed I do have cancer. I was shocked, and he was quite shocked that I knew already. And I explained to him, I found out when I came for the CT scan, there's 2 words they were mentioned, pathway to colorectal cancer, and I'm on chemo. That's how I figured it out. This is something serious. After that, I was offered to have an operation done within 3 weeks from that time, within 2 to 3 weeks. I had my operation done at King's College Hospital. I had chemotherapy at St Thomas's Hospital, and I saw my oncologist at St Thomas's Hospital, and I had my lines and my PICC lines and HIC lines put in at Guy's Hospital. During my period of having chemotherapy, I was literally in and out of all 3 hospitals, sometimes twice a week, in all 3 hospitals in one day. I'm one of the lucky ones. I count myself lucky. At the end of May this year, I'll be 5 years in remission, and by August this year, it will be 6 years since they've diagnosed my cancer. I still stay in remission, but I think with my experience, even though my GP sent me back and forward to the hospital, and I kept being sent home, that there's nothing wrong with me, I feel something needs to be improved within the NHS. I feel that I wouldn't want anybody else to go through this experience. I'm the first person to be diagnosed within my family who've ever had cancer, and I just feel I need to give something back by sharing my story and how NHS could get better and be improved. I have decided from my experience to join my patients group at my doctor's surgery. I'm also a member of the North Southwark Patient Group. I'm also a member of the CCG Engagement Patient Experience Committee. I'm also a member of our Healthier South East London Cancer Clinical Leadership Group and their Patient Advisory Group. I would offer my experience to NHS for NHS to get better. Thank you.